Vitiligo, white patches appearing on the skin. The patches can remain localized or rapidly spread. When you find a small white patch in your normal skin color, you may wonder what it is. Most people have never heard of vitiligo, or Leucoderma as the skin disorder is called. What causes the white patches of skin, and will it go away? Leucoderma, or vitiligo, is a skin disorder that causes the skin to lose its pigment, the melanocyte skin cells that are responsible for giving our skin color or pigment. They die off. This turns the skin white as it lacks any pigment. No one completely understands the reason the melanocytes die off. It could be a virus, emotional stress, an autoimmune disorder, or hereditary. Once you lose the pigment in your skin, the areas turn white. You cannot recover lost pigmentation. There is no known cure for vitiligo, but you can treat it successfully. Darker skin tones make this condition highly visible and can lead to emotional upset and distress. If you notice white patches appearing on your skin, you should seek medical treatment. In most cases, the patches will grow and cover larger body areas over time. Others may find it stays localized and may not grow. Actually, it's not growing at all. It is just when more melanocytes die off, more skin loses its color. What causes vitiligo? The most common cause of vitiligo is thought to be an autoimmune disorder, or when the individual's immune system becomes overactive and destroys the pigment-producing cells, creating white patches of skin. There is no definitive cause for vitiligo. The immune system seems to just attack the melanocyte cells, which are the pigment-producing cells, as if they are preventing an illness, resulting in white patches of skin. Most researchers hold their own theories, such as severe sunburn triggers destruction of the melanocytes. Emotional distress or a stressful event can trigger it. The melanocytes simply destroy themselves. A virus or viral infection triggers the condition. Hereditary. If a relative has vitiligo, then the children have a higher likelihood of developing the skin disorder. Exposure to certain chemicals may trigger this disorder. The good news is that the vitiligo skin disorder is not contagious. No one can catch it from you. There's two types of vitiligo, non-segmental and segmental. Vitiligo can be defined as falling into two types of skin disorder, segmental vitiligo and non-segmental vitiligo. The most common form of vitiligo is non-segmental. This form affects about 90% of vitiligo sufferers. If you develop vitiligo in your teens, you're more likely to have non-segmental vitiligo. This form of vitiligo is where the white patches appear symmetrically on your body and typically in areas exposed to sunlight. The second form is segmental vitiligo, where there is a rapid appearance of white patches of skin and there's no defined symmetry, but it does spread rapidly over the body. Segmental vitiligo is considered constant and stable. What are the best vitiligo treatments available? Medically, the best way to treat vitiligo skin disorder is heliotherapy, better known as phototherapy, UVB light therapy for home use, or phototherapy with UVA plus the drug psoralen. Both of these treatments will help reduce the visibility of the white skin patches. Your doctor in most cases will begin vitiligo treatment with the phototherapy using UVB light. It is the easiest and cost-effective treatment to treat vitiligo. Affected skin is exposed to UVB light therapy in a clinic setting or at home, once per day or 3 times a week if done in a clinic. 1 to 2% of the USA population suffer with vitiligo, and narrowband UVB phototherapy has been shown to be effective in repigmentation in vitiligo patients. It is also an effective therapy for the treatment of many other skin conditions such as psoriasis, acne vulgaris, skin cancer, eczema, atopic dermatitis, and wound healing. It is also an effective treatment for SAD, seasonal affective disorder, and non-seasonal depression. If the vitiligo affected area is not large, you will probably be allowed to carry out home phototherapy treatments. Larger areas of vitiligo require the treatments to be carried out in a clinical or hospital settings, as they have adequate equipment to treat larger areas effectively. Vitiligo's skin disorder is not curable. You can treat the affected white areas and make them less visible, which certainly helps sufferers emotionally and physically. If doctors don't get satisfactory results using UVB light therapy, they can resort to UVA light therapy along with the drug psoralen. Psoralen makes the skin more receptive and sensitive to the UVA light therapy. Phototherapy using the UVA light will be conducted twice a week in a hospital setting. Improvements in the vitiligo affected skin can generally be seen after about 6 months. Typically, treatment is ongoing for a year or so. Side effects of light therapy. Many think that just because UVA or UVB lights are used to treat vitiligo, there will be no side effects. However, this is not the case. Granted, not everyone will suffer side effects of phototherapy. However, it would be remiss of us if we didn't point them out. It is well known that UV light, ultraviolet light, causes progressive damage to the skin, particularly collagen damage, destruction of vitamins A and C, plus there is a risk of eye damage. UV lights have been linked to cataracts. Lamps used for the treatment of SAD, seasonal affective disorder, have filtered out harmful UV rays. Therefore, if you use this type of home light therapy, it is considered safe providing you don't take photosensitizing medications. If in doubt, always ask your doctor or pharmacist. Never self-treat. It is always advisable to seek a doctor's approval before commencing light therapy to treat any disorder. Common side effects of light therapy also include jitters, jumpiness, headache, eye irritation, and even nausea. The best treatment for vitiligo is natural remedies that do not have harmful side effects. Nature has provided an abundance of plants and herbs that can treat most disorders. If you would like some tips to treat vitiligo skin disorder naturally, click the link below this video or visit us at vitiligoinformation.info. Help is available. One vitiligo sufferer developed a cure for his vitiligo. He now offers a program that will help you eliminate your vitiligo in 8 weeks or less. In fact, he guarantees it. You can watch his video here at vitiligoinformation.info. It's 100% risk-free, guaranteed to cure your vitiligo within 8 weeks or less. Click the link below now, vitiligoinformation.info.